Congrats, Ash. The article in Lancet is a great achievement. Congratulations. I was really keen to understand that what are the practical implications of the guidance which comes from that article for the industry, for the pharma and the device companies, especially as they prepare their campaigns and programs. What are some of the practical takeaways which the companies can take out from those, in the article?
Thank you. It's really exciting to see those guidelines published, and I guess that whole narrative around that involving consumers is really important from the very start. And so I think involving people with diabetes from the very get-go really helps to change the way the impact of the project is delivered. And I think some of the key takeaways would be, involve them from the very start. So start reaching out to people with diabetes from the very start, ask them and get their perspective, and be flexible and open to their ideas. So often when people come to the diabetes community, they already have a set idea in mind. And so it's very hard to then change that idea. But if you involve them from the very start, from their conception phase, it's easier to then keep the ball rolling, and you're not wasting time sort of developing something and then going back, scratching it all and starting again. So that would be one of the first key takeaways. The second one is to involve them meaningfully. So keeping that communication happening, even, throughout the project when there's nothing happening, just tell them, say, things are happening, but, you might not see anything, but there's a lot happening in the background. I think the diabetes community really appreciates being kept in that feedback loop. And what often happens as well is at the end of the project, particularly in research, you just get this little A4 sheet of summaries and that's it. So I think that's also where the limitations of research lies in terms of the funding. So there needs to be an advocacy piece that goes forward in terms of how do you then translate those research findings into practical terms. And that's where the diabetes community can really come into play. We've seen the power of advocacy from the community, and I think this is where you can translate those research findings into real life as well. So I think just focusing on those two small things will create a huge difference. There's absolutely a place for telehealth when it comes to diabetes education and diabetes healthcare delivery. We know that diabetes is such a self-managed condition, and there's so much involved in there. We know that one of the barriers to people actually going to appointments is having to take time out from the day to then, do traveling and find parking and actually make it to the physical location of the clinic. So I think if there's flexibility through telehealth, people will definitely take that up. They can easily fit it within their days, and once you set up some different principles around, making sure you have a quiet environment to talk to that, these are, general best practices for telehealth, and we will embody all of that. I think that will be really key in setting up a good telehealth practice that offers sort of flexibility but also accessibility, particularly for people that are living in outer suburbia or rural remote regions that may not be able to travel to go into in-person clinics as well. So there's definitely something there for telehealth that people would take up. Finding out what your favorite colors or favorite cake flavors were, or whether you have any dietary intolerances. And so they plan this whole party, you show up and it just doesn't work for you. You hate everything about it. This is why it's important to involve the people who are the end users from the very start of research in healthcare delivery, planning what needs to happen, all the way through to delivery and implementation.